All right. I'll come back to number 1. All right. So go ahead, guys. Drop your answer in the chat. Okay. JT Honey, good to see you. Good to see you. Bellug, Amber. All right. Lots of familiar faces. All right. Fantastic. Yep. We will jump through some of these early ones. Yep. The correct answer is A. Drooling and inability to manage secretions. So, yeah, respiratory muscles here. Respiratory muscle weakness is potentially an airway compromise, and it is a hallmark crisis. I don't think anybody got that wrong, so no need to dwell on it. Here we go. Question 3. Post-op day 1 patient. There's a red word, a red flag word. Post-op day 1. After abdominal surgery, reports severe abdominal pain relieved by opioids, abdominal distension, and absent bowel sounds. Which action should the nurse take next? All right. I feel like I tried to make these questions. I mean, we're only 2 questions in, but I feel like in general, I tried to make them a little bit harder. All right. So, all right, I'm seeing B and A. Majority B so far. Carousel, good to see you. All right. Thank you guys for all the likes on the live and for reposting the live. All right, yep. The answer here is going to be B, notify the provider of a suspected obstruction. All right, we're talking about absent bowel sounds, okay? Distension, worsening pain. So we're looking at a possible ileus or obstruction, okay? Needs immediate intervention. All right, someone said A. Ambulation might be helpful, but not when an obstruction is suspected. All right, Alfredo, thanks for reposting the live. All right, 4, select all that apply. Here we go. Nurses caring for a patient with pancreatitis. Which finding requires immediate intervention? Select all that make you cry. Let's go. All right, TJ Boss Lady, thanks for reposting. I have a feeling we are going to break the record tonight for most people in my live. The record currently is 695. All right. Let's do it. Let's shatter records. All right. I'm seeing A, B, and A and N. Remember, treat each of these options as its own true false, okay? Treat each of these options as its own true false. All right. So the answer here is going to be A and C. That's it. All right. We don't need to pick any more. You don't need to make it work. All right. This isn't, a past relationship with a toxic ex. Okay. You don't need to make it work. All right. Only 2 answers this time. So A and C. So for A, we're talking about gray Turner sign, which is flank bruising. Okay, bruising on the flank that lead to a hemorrhage risk. All right, for C, we're talking about a calcium of 7.2. That is low, hypocalcemia, which is a deadly pancreatitis complication. All right, B is expected. All right, we are expecting to find that with pancreatitis. D is a common trigger, and it is also expected. And E, mild hyperglycemia is expected due to pancreatic dysfunction. Okay, so yeah, A and C are dangerous. Yep, and bite-sized blessing. Yes, we did maternity already. It was one of the lives in one of the last 2 lives we did a bit of maternity. All right. Very good, guys. Very good. 5. Here we go. Patient, COPD, receiving 4 liters. Nasal cannula. They become increasingly confused and drowsy. There's their ABG results. Which action is the priority? Stop. Eden says, I was here last week. I just passed my NCLEX. Good. Hell yes. That's what I'm talking about. Everybody drop some, after you answer, drop some love. for Eden in the chat. Just passed her NCLEX. Fantastic. Dr. Lee, good to see you. Gosh, proud of you guys. That's awesome. That's what it's all about. Megan, good to see you. All right. So, question 5. Which action is the priority? All right. The priority action here is going to be C. All right. We need to prepare for possible non-invasive ventilation. So here the question is describing CO2 narcosis with worsening respiratory acidosis. All right. So know your ABGs. So essentially they need BiPAP ASAP. BiPAP ASAP. Okay. It's not A, that could worsen CO2 retention. It's not B, that'll worsen hypoxia. And D is wrong because they lack the capacity for effective deep breathing. Okay? There you go. Question 6. FA, thanks for the follow. Hey guys, if you are just jumping in and you're not following, go ahead and do that because we do these lives every Sunday, Tuesday, Thursday at 9 p.m. Sunday, Tuesday, Thursday, 9 p.m. Eastern. All right. And I would love it. It's up to you. But if you share the live down there, that helps us work towards breaking our live record of 695 people. All right. Fantastic. Here we go. Which finding requires immediate intervention? All right, guys, immediate. Oh, not going to trick you guys today. Not going to trick you guys today. All right, they're learning. For those regulars in here, it's like, oh, hold on a second. I see potassium in the question. All right. So, yeah, we need to fix that potassium. A. All right, insulin, okay, when we're talking about a DKA patient, we need to understand that insulin is going to push potassium in the cells. So if we don't correct this potassium, the potassium is just going to get worse. And right, potassium pumps the heart. PPs, potassium pumps the heart and can lead to fatal dysrhythmias. All right, so that is the answer. All right, and 7. Here we go. A nice long one. All right, up to 225 people. Hell yeah, let's go. Yep, Morgan, I am in Charlotte. Your last name sounds familiar. Like literally, I saw your last name today. All right. Oh no, I'm Morgan. Yeah, okay, I did a study plan. I did a study plan for Morgan. That's where it is. That's where I saw your name. And it wasn't there. Okay. Morgan's in Charlotte. Hell yeah. All right, guys, let's go. Okay, so 7. Which action should the nurse take first? All right, so correct answer here is going to be B. All right, we are going with B. So start a large bore IV access, begin fluid resuscitation. All right, this patient is showing classic signs of hypovolemic shock, and restoring that intravascular volume has to occur immediately to prevent this pending cardiovascular collapse. Okay, that's what is going on here. So that stabilization is going to take priority over diagnostics or medication. All right, so that is, I don't know that there's really should be any, I mean, there might be questions as to why that's the right answer, but takes priority over diagnostics or medication. Okay? All right. If you see a medication or IV access to begin fluids, like you assume you have the order for it. Okay? All right. 8. The answer to that last question was B, start large bore IV access. All right, Naomi, good to see you. All right, guys, question 8. All right, know your vent alarms. When's the high pressure versus low pressure? Okay. All right, so. All right. Majority of you are saying A, and that is the correct answer. Okay, so the high pressure alarm, there's an obstruction or a kink, something like that. So the answer here is A. All right. So I don't know that I saw really too many other answers here. All right, it's not B because increasing the FiO2 does not fix an obstruction. With C, deflating the cuff risks aspiration. So we're not going to do that. Okay? All right, good job. 9. Here we go. A patient with known cirrhosis is admitted with worsening confusion, hand tremors, difficulty following instructions. Their ammonia level's 95. All right. Thank you, guys. It looks like y'all are kind of answering each other's questions in the chat. Fantastic. Much appreciated. All right. Okay, cool. All right, so which prescription should be administered first? All right, everyone's jumping on the lactulose train, and that is the correct shitty train to be on, right? Lactulose, not ideal. I mean, the aftermath of lactulose is the code brown that you'll have to deal with, but that's for another time. So yeah, right here, they're showing signs of hepatic encephalopathy. So that ammonia is accumulating and impairs neurologic function. So that lactulose, it binds to the ammonia and removes it through the GI tract, and then they poop a lot. Do you see the trauma in my eyes? They poop a lot. All right, 10. Here we go. Guys, we are going to 50. So if you're just jumping in, fantastic. Thanks for joining. I'm Nurse Jimmy. I'm an ER nurse, and we'll help get you across the NCLEX finish line. All right. So if you haven't already, you can go ahead and follow up here. We do these live Sundays, Tuesdays, Thursdays at 9 p.m. Eastern. Okay. Here we go. Which order should the nurse question? I see people saying B, A, D. Geez, you guys are debating life on all of these. Map of 58. Okay. Yeah, Vera's like, that map, guys. Yeah, exactly. So the answer here, guys, is going to be D, IV metoprolol, which looks like the majority of you are got it. All right, MAP stands for mean arterial pressure. You want that to be above 65. All right. All right, so 65 means you at least have minimal pressure to perfuse your vital organs. Okay, so MAP of 58, too low. If you give IV metoprolol, you're going to, metoprolol is a what kind of med, guys? It is a beta blocker, right? And it's going to decrease your heart rate, and it's going to decrease your blood pressure, which thereby will further decrease your mean arterial pressure and unalive your patient. Don't do that, okay? All right. Yeah, so that's why that takes priority. All right, 11. Here we go. A patient receiving a packed RBC transfusion suddenly develops lower back pain, fever, chills, and dark-colored urine. The nurse stops the transfusion and assesses the patient's airway and breathing. The patient has stable vital signs, but continues to report worsening pain. What should the nurse do next? All right. So, all right. We are kind of split on this one. Okay. So here, the answer here, guys, actually is, okay, C. All right. So send the blood bag and tubing back to the blood bank. The patient's experiencing an acute hemolytic transfusion reaction, which will require a full investigation by the blood bank. So sending back the blood bag and tubing is going to be critical to identify the cause. All right. So this step will occur after the transfusion is stopped. All right. A lot of you were saying about D, all right, diphenhydramine or Benadryl is for allergic reactions, okay, not hemolysis, okay? Again, this is talking about an acute hemolytic transfusion reaction. Benadryl is not going to fix this, okay? For B, documentation is necessary but not the priority, and yeah, it's not A, okay? All right, Vera says, love this question. Hell yeah. Okay, 12. Here we go. For those of you who've been a part of my lives, do you feel like these questions are, good difficulty level? They're a little harder than normal, or that you've experienced? All right. Excellent. All right, we were talking about a patient on a surgical unit and what assessment is the most important at this time. Okay. Here we go. I see a lot of B's. So let's see if you're right. The answer is, in fact, B. All right, assess for the serum calcium level. So these symptoms that they're describing, paresthesias, positive Schachter sign, and muscle twitching, suggest acute hypocalcemia. All right. This can sometimes be caused accidentally with removal or injury to the parathyroid glands during surgery. So, all right, yep, I think the majority of you said B. So here we go. These are, when we're talking about the, unstable patients, you're asking about these LPN or RN questions. The majority are, it's built for RN, but we're going to see there will be some PN overlap, okay, when we're just talking about basic prioritization. All right, these questions are nowhere but with me. I generated these questions. All right, 13. All right, what should the nurse do first? Everybody saying B. A few C's. The answer is going to be B. All right, we're going to prepare the IV insulin and dextrose. So here we're talking about severe hyperkalemia. All right, and we understand the treatment to hyperkalemia, high potassium, is going to be insulin, dextrose. Those are a couple of the first meds you give. So that has to be the priority here because, again, we're talking about the calcium level, 3.5 to 5. If it's outside of that range, more than likely, there's going to be something that needs addressed in the question. Okay? All right. Hello, hello. Here we go. Okay. So 14. All right. Thank you guys for the follows. Much appreciated. Again, we do these live Sundays, Tuesdays, Thursdays. So if you're not already following, feel free. Would love to have you. Fantastic. Thank you guys. Thank you guys. All right. So what action should the nurse take first? All right. What action should the nurse take first? All right, the majority of you are saying C, and that is correct. All right, apply high flow oxygen. So right now in the question, they're describing a patient showing signs of acute respiratory compromise. All right, so we need to immediately apply oxygen because that is the highest priority. All right, increasing the concentration and flow rate of oxygen will stabilize the airway until further interventions can occur. All right, so without this step, the patient may progress into respiratory failure, which we don't want, right? Okay, so it's not A, incentive spirometry is not effective during distress. It's not B, ambulation is going to worsen instability. And it's not D, you notify after stabilizing the ABCs, all right? And go live 3 times a week, Sunday, Tuesday, Thursday. All right, here we go, 15. All right. What is the answer? What is the nurse's priority action? All right. Majority of you are selecting A, and that would be incorrect. What? Yeah, you're wrong. Okay. It does not stop the TPN infusion immediately. Why? Okay. Why, you ask? Well, let me tell you. All right. So the answer is C. All right. Check IV patency. Okay. Prepare to administer insulin. All right. Hyperglycemia is a known risk of TPN. All right. It can quickly lead to like osmotic diuresis and neurologic changes. Okay. But insulin here is going to be needed promptly to lower the glucose and prevent any other metabolic complications. So, 1, we need to confirm IV patency to ensure that the insulin can be delivered safely. Okay, so here, if you stop A abruptly, we don't stop TPN abruptly, it risks hypoglycemia and rebound instability. Okay, B, increasing the TPN will worsen the hyperglycemia, and with D, D10 is used when TPN is stopped, okay? Not during hyperglycemia. All right, does that make sense? All right, so hyperglycemia is a known risk of TPN, okay? All right, good job. Here we go. All right. We got some thumbs up. Fantastic. Victoria, thanks for sharing the live. Kat, thanks for the follow. Pow, 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 pow. I don't know what that was. Excuse my hands. I don't know what to do with my hands. I told you the answer was C. Check for IV patency and prepare to administer insulin. You guys like my water bottle? All right. Which patient should the nurse see first? All right. Answer is B. All right. So we see the words post-op with sudden bright red drainage. Okay, that sudden significant red drainage suggests that there's possibly an active hemorrhage going on. That should be evaluated because it could lead to shock. All right, yeah. Post-op, less than 12 hours is a priority. Fantastic, Dr. Lee. All right. All right, it's not A. COPD is stable, okay? With C, chronic fatigue is expected, and D, stable angina, excuse me, without pain is a low priority, okay? All right, here we go. All right, reports chills, feels warm. Finds it to be one. All right. I feel like everybody is jumping on that B train. Yep, and that is the correct answer. The correct answer is B. All right, so we are, of the answers here, the best one is B. All right, we're going to notify the provider, prepare to obtain blood cultures because a fever and a neutropenic patient is going to be a medical emergency. All right, so this could very easily lead to some sort of life-threatening sepsis. Okay, so that's the answer. That's the only one that makes sense. All right, 18. All right, Taylor, thanks for the follow. Nicole, thanks for the follow. Appreciate you guys. The answer was B, notify the provider, prepare to obtain blood cultures. Oh, Cutie Pie Sweets is late. It's all right, you're only on question 18. We are going to 50. It's okay. It's okay. Which intervention should the nurse initiate first? Majority of you are saying C. Jasmine says your normal heart rate's 138. Is that real? What do you got going on that you're normal? You don't have to tell me. That you're normal. Is that real? Your resting heart rate's 138? All right. Yep, C. So the answer is C, start IV fluid resuscitation. So the patient is showing signs of septic shock from peritonitis. So making the fluid resuscitation the first priority to maintain perfusion. Okay, let's see. A, no. NG tubes here are going to reduce gastric contents, but don't address the shock. With B, antibiotics come after fluids in unstable patients. And D, pain control is not life-saving in this context. All right. Thank you guys for liking the live and sharing the live. Much appreciated. All right. Yeah, standing in the way. Oh, POTS. Okay. All right. That makes sense. All right, guys. What do you think? Are you going to be tricked? Are you going to be tricked? Bella? No? Oh, we got some people. We got some people. Oh. All right, the majority of you got it right. All right, so answer here is A. All right, we need to check the patient's blood glucose here. All right, so when we see acute neurologic symptoms, these can mimic a hypoglycemic episode. So that must be ruled out immediately because if it is that, it's rapidly reversible. All right, so we need to very quickly rule that out. All right, and then if it's not that, continue on. All right, so yes, low blood sugar can very often mimic stroke, and it gets missed because it's not checked quickly enough. Okay, all right. All right, 20. All right. Which patient should the nurse assess first? Which patient should the nurse assess first? All right. I'm seeing A and D. A and D. Okay. Yep, guys, the answer is going to be D. All right. So patient with new oxygen requirement and respiratory distress. Okay, that seems to be the one that makes the most sense here, right? So those things suggest that there's new or escalating respiratory distress, which will always take top priority, okay? Airway, breathing, circulation, okay? Pain is not urgent. It's not life-threatening. All right, discharge teaching can wait. All right, and if it says stable in the answer, it's probably not the correct answer. All right, good. 21. I meant to take a 30-second intermission after that last question, but we'll do it after this question. I just have a couple things to relay to all 320 of you real quick. But we'll do it after this question. Thank you guys for sharing the live. Thank you guys for liking the live. All right. So, which action should the nurse take first? Okay. The patient's disoriented, has coarse tremors, reports feeling unsteady. All right, the patient's increasingly lethargic. All right, so here the answer is actually, for this question, the answer is actually B. All right, initiate IV normal saline infusion. So right here, this patient has moderate to severe lithium toxicity, which is going to be worsened by volume depletion. All right, so the immediate isotonic fluids dilute the lithium levels and enhance renal excretion. All right, that should, so by restoring the perfusion, that's going to be the critical first step before considering dialysis. All right, so holding the lithium is appropriate for A, it is appropriate, but it does not rapidly reduce the toxic levels. Okay, doesn't reduce the toxic levels, whereas the fluids do. Don't melt, Bex. Oh, okay, you got this. All right, it's not C. Dialysis may be required, but fluids need to be started first, and cardiac monitoring is appropriate, but need to stabilize. That's going to take the priority. All right, real quick to all 350 of you, if you guys are new here, hey, I'm Nurse Jimmy, and I help you guys hopefully cross the finish line to the NCLEX. I've got, I think, 3 things. All right. If you're not already following, I would greatly appreciate it. There's a lot of good content on the page itself. I have a whole NCLEX review series, 34 parts, I think now. So go ahead and follow if you haven't already. All right. And now, if you're studying for the NCLEX, I do create custom NCLEX study plans. All right. And you can find that via the link in my bio. All right, and when you get to my bio, it looks something like this, okay? So here you can, at the top, you click the link in my bio, it takes you to this page, you click, get a custom study plan, and basically you will fill out a form. It is $25, but that's just because I tailor them all to you. All right, Amber's in the chat saying they're awesome. All right, because it does take all of the guesswork out of your studying. Okay, it does take all of the guesswork out of it for you. What to study when, and if you're a repeat test taker, it takes the your CPR into account. So everything is tailored to you, your subscriptions, your resources, all that, okay? Also there, below that link to request your study plan is the NCLEX Vault. All it takes for that to open is your name and email address, okay? It's 237 pages of cheat sheets and mini quizzes. It's a great guide. There's strategy on how to break down each type of question. That's there. It's totally free. But if you're interested in a study plan for some additional resources, definitely check that out. Okay. Now, let me find, I think we were on 20, we just did 21. So here you go. Awesome. Already getting notifications that we're getting people signed up for the Vault to be a subscriber. Awesome. Here we go, guys. Here we go. All right, awesome, Sydney. It looks like Amber just joined the mailing list as well. Awesome. Okay. So we're talking about ARDS, all right, and breath sounds or absent on the left. What should the nurse do first? All right. The answer here is going to be B. All right, disconnect the patient from the ventilator. I'll tell you why. All right, don't freak out. Don't freak out. All right, so these symptoms indicate a tension pneumo, all right, which is a life-threatening condition worsened by positive pressure ventilation. Okay, so disconnecting the vent prevents further air trapping while the team prepares for emergent decompression. Okay, with that needle, that 14 gauge needle, right? So that's the immediate life-saving step. All right, for A, increasing oxygen doesn't resolve airway collapse. C, notification comes after emergency action. All right, and for D, there's no indication that a chest tube is already in place. Okay, all right. Nope, it's not D. It's not D, it's B. Disconnect the patient from the ventilator because the signs are pointing towards a tension pneumothorax, and you don't want to keep putting positive air pressure in there because you're going to make that air pressure worse within the chest. All right, very good. 23. Here we go. Good, thanks. Getting lots of signups for the mailing list. People accessing the NCLEX Vault. All right, via the link in the bio. Awesome. You guys will love it. It's I feel like it's a really good resource. There's cheat sheets on literally every single subject that you could possibly be studying for the NCLEX. And it's all high yield stuff. The answer for 22 is disconnect the patient from the vent. B. All right. What should the nurse do first? All right. Answer here is going to be B. All right. Administer high flow oxygen. So right now, a suspected PE is an acute oxygenation emergency. Okay. So the hypoxia must be corrected immediately. Oxygen is going to improve the perfusion there in the tissues, and while diagnostics and treatment are going to be arranged. All right, but the oxygen is the primary response. Okay, it's the fastest intervention to prevent any further decline. All right, so it's not a ECG does not stabilize the patient. All right, thrombolytics require confirmation, provider decisions. Right, Trendelenburg is going to worsen ventilation and perfusion. All right. Chula thinks these questions are getting harder. I don't know. I think it's individual dependent. All right, let's go. 24. Julia, today's topics are more prioritization and MedSurg. Oh, you work in cath lab. Awesome. I feel like that's some exciting stuff sometimes. All right. Thank you guys for the follows. All right. 24. All right. Good job, guys. Yeah, the majority of you are jumping on C. That's the correct answer. Start aggressive IV fluid resuscitation. Answer is C. All right. So here the patient is showing signs of hemorrhagic pancreatitis and hypovolemic shock. So because they could quickly die from that, we need to address it and start rapid IV fluid resuscitation. Okay? That's the answer. I think pretty much all you got that. Let's keep going. We're a bit behind schedule here. All right. Julia says she graduates Friday. Hell yeah. The cheat sheets are in the doc, Sydney. They are in the doc. When you open it, you just might need to go to the top right if it gives you the option to look at all of the tabs on the doc, okay? There's many tabs. It's kind of like a notebook. All right. What should the nurse do first? All right, answer is going to be B, elevate the head of the bed. All right, so in the question, we're trying to describe Cushing's triad, right? So that is showing signs of intracranial pressure, yada, 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 Cushing's triad, right? So elevating the head of the bed is going to improve the venous drainage, all right, which can temporarily reduce ICP. So when you say, what are you going to do first? Well, we're going to do that because it's the fastest intervention while preparing for intubation or surgical action, okay? All right. It was like, Regal's like, Lord, oh my. The answer was B, elevate the head of the bed. All right, here's another TPN question. But you ask, well, Jimmy, when do I stop the TPN? This is the answer where you would stop and hold the tube feed, okay? Place the patient upright, all right? Hyperglycemia, we can manage that with a little, IV insulin, make sure their IV's patent. Here, this is signs of aspiration. So we need to stop, sit them up. Okay. Answer is B. All right. Good job. Good. 27. What action should the nurse take first? All right. Which action is going to work towards fixing the symptoms that are being described in the question? All right, you guys are split here. All right, so answer's A. All right, administer sub-Q epi. All right, this is what they're describing as life-threatening angioedema. Okay, epinephrine is the only intervention that can rapidly reduce airway obstruction. Okay, so we need to give that early to prevent respiratory collapse. So All others help support the airway management, but are not as immediate. So we need to give that epi first. All right, intubation may be possible due to swelling, but the epinephrine is going to come first. Okay? All right. All right, I see it now. I says, yep. There we go. Which action should the nurse take first? Which action should the nurse take first? All right, majority of you are saying B, 428, and that is the correct answer. All right, yep. So B is the answer. We're going to give that IV furosemide or Lasix, right? So the patient is showing acute decompensated heart failure with some pulmonary edema. So we need those loop diuretics to reduce the preload and improve oxygenation quickly, okay? Weight tracking and fluid restrictions are going to be secondary. All right, good job, 29. All right, here we go. Uh-oh. What's going on with this person? All right. I don't think there's a consensus answer yet. All right. Answer here, guys, is going to be B. All right. Applying the non-rebreather mask. So the presentation likely indicates a post-op PE, pulmonary embolism, okay, requiring immediate high flow oxygen. All right. Just cheese that. Yes, girl. Clock that shit. All right. A non-rebreather is going to provide the fastest oxygenation support. All right. Slow breathing and coaching does not improve oxygenation. Okay. So, yeah, there it is. Yep, you guys love when I clock it. Jasmine, that's what I'm talking about. You know, hey, I've got a daughter in middle school. I know a lot more lingo. Okay. All right, 30. All right. Oh, and just got an order for a study plan. Excellent. I don't see the name yet. Doesn't pop up, but if it was you, call yourself out. Let's go. All right. What should the nurse do first? Okay. All right. Majority of you are saying B. Yep. All right. Good job, guys. Answer is, in fact, going to be B. All right. Initiate droplet precautions. So, yeah, so we're talking about purpura plus neurosymptoms, and then leading to essentially meningococcemia, which is highly contagious. Okay, so precautions are going to prevent the spread and must occur before any diagnostic procedures. Okay, so safety of others always matters too. All right, let's see. For A, the LP increases exposure risk, okay, if the precautions aren't in place. And C, fever control does not prevent transmission. Okay, you need to put the measures in place. Taking care of their fever does not prevent transmission. All right, and then D, cultures are important but secondary to isolation. All right, 31. Don't be tricked. Don't be tricked. Oh, you guys. Oh. Oh. You guys have been had. You guys have been tricked. It's okay. This one's tricky. Okay, because obviously I think everyone generally understands that we're talking about red man syndrome, right? But the answer is not A. It's B. Okay? Now let me see all your crying face emojis. Oh my God, Jimmy, what are you talking about? Why is it B? Okay. What? Why? Yep, there it is. Crying face emojis. Oh, they make me happy. No, I'm kidding. Okay, so guys, VANC. Okay, red man syndrome is not necessarily just caused by VANC. Okay, it's caused by rapid infusion of VANC rather than that it's an actual allergy. Okay, so usually slowing the rate resolves the symptoms. Okay, so stopping the infusion is not necessary unless the symptoms worsen. Okay, so when you see IV VANC, they're describing the question red man syndrome. Okay, you don't automatically stop the infusion. The treatment is usually to slow the infusion. Okay, all right. It's a side effect of usually rapid infusion, not an allergy. Okay? All right. Hamdi took her NCLEX today. Let's go, dude. Hell yeah. All right. Good luck. Fingers crossed. Fingers crossed for Hamdi. They're always in here. All right. Send all the positive love to Hamdi in the chat. All right. Yeah, Hamdi, drop it. Spill the tea, as the kids say. Okay? All right. 32. What should the nurse do first? All right, majority of you are saying B for 32, and that is correct. All right, so notify the provider of a suspected rupture. All right, yep. So the sudden relief of pain with the appendicitis suggests rupture. All right, surgical emergency. So for A, no, the pain is no longer the primary issue. Then for C, positioning does not treat the peritonitis. And D, imaging must not delay any surgical decision making. Okay? Here we go. Yeah, Hamdi, where'd you go? Did you drop off the face of the earth, man? Spill the tea for Morgan and family here. All right, 33. What should the nurse do first? Think, is this patient in crisis? We're talking about sudden, increasing weakness, difficulty swallowing, shallow respirations. Okay, the answer here is B. Bravo. Okay, prepare for mechanical ventilation. So this is a myasthenic crisis where respiratory failure is imminent. Okay, ventilatory support takes precedent and priority over medications. So giving the med may not act fast enough to prevent the collapse. Okay, so medication does not immediately reverse a crisis. All right, for C, they cannot cough effectively, and D, infection is a cause, not the priority. So the answer, the only answer that addresses the problem immediately is B. Okay? All right, here we go. 34. We are going to 50 for somebody who asked how many are we doing. Okay. Okay. 34. Okay. Priority intervention is B, which I think the majority of you got, like over 40 of you said B. Yeah, so here we're describing delirium tremens, which is the worst of the worst alcohol withdrawal. Okay, it's a life-threatening condition, requires rapid sedation from benzos. Okay, so Ativan, Valium. Okay, so that's going to prevent seizures and further autonomic instability. So we need reorientation and environmental change are not going to stabilize the patient. Okay. All right. I don't really have time to go over seawall, but typically if your seawall is like greater than 8, then you give a dose of benzos. If it's greater than 10 or 11, you give a larger dose. All right. And then you do that like every 2 hours or every 4 hours, depending on your hospital's policy. But yeah, yeah, you can Google it. You can put it in ChatGPT, whatever you want. But yeah, pretty straightforward. Okay. All right, 35. There we go. Yep. No problem, Emmy. Good to see you, Emmy. How many meds do you usually need to know for school? I mean, it's not really knowing 250 meds. It's knowing their endings. It's knowing what category. Like you can look at a med and is it a dipene? Is it a lull? Is it a pril? And just generally knowing what those medications do. Okay. All right, so 35. Answer here is going to be C. Start a new IV and initiate fluid resuscitation. Okay, the patient is in septic shock. So immediate fluids improve perfusion and reduce mortality. So good job if you got that. Okay, that was a little tricky. It's not A, that's not a priority during shock. For B, while it's helpful, it's not life-saving and not the first action. And D, well, you should stabilize before notifying. Okay. Jesse, clock it. Hell yeah. Hell yeah, girl. Clock that shit. All right. 30. Oh, we're over 400. I wonder if we can get to 5 before we get out of here. All right, we need to zoom through some more of these questions. We are behind schedule. All right. I was trying to end at 10. All right. Thank you guys for all the likes. Oh, gee, we're almost up to 20K likes almost. When my daughter comes downstairs, I gotta flex a little.
You got it, bud.
You got it, bud. Good boy. All right. So 36. We're talking about B. All right. The priority intervention. Okay. The 36 is B. Give fresh frozen plasma. You guys are all over the place. Go cry into your flashcards, little boys and girls. Oh, this is fun. Okay, so think about it. Okay, so with an INR this high and symptoms of internal bleeding, okay, FFP provides rapid reversal of this coagulopathy. Okay, so vitamin K works slowly and does not meet the urgency of the situation. Okay, so holding warfarin also doesn't correct, all right, the existing danger. Okay, all right, fair. Oh, you're so right. Okay, not trying to make y'all feel bad about yourselves. All right, although I do get some enjoyment whenever there's a lot of confusion. But that just means we're learning, right? We're learning. Good job. Keep learning, guys. All right. All right. A patient with chronic kidney disease reports nausea and muscle cramps. Holy moly, is that a high or low potassium? And widening QRS complexes. All right, guys, think about this. If you had to pick one of these options, leave the room and never come back, which one is going to help the patient? Is it going to be put them on a cardiac monitor? Is that going to help their potassium at 7.1? No, it's not. Okay, so if you had to ghost this patient and only do one thing and never come back, you're going to want to do C. Okay? C. Administer the calcium gluconate. So calcium gluconate stabilizes the myocardium immediately, okay, and prevents those fatal arrhythmias during severe hyperkalemia. So it does not lower potassium, but buys time, all right, so that you can do other interventions. All right, cardiac monitoring is needed, all right, but not first. Stabilize the freaking heart, okay? Boom, boom, boom. What'd you say about my questions? Yes, please keep doing the questions like this. Yeah, there you go. What other interventions? Oh, after calcium gluconate, you do the insulin and dextrose, and then the K-exlate. That's typically the protocol. Sorry, hold on. I'll adjust the size. Chill. What question was I on? Okay, we were on that one. So 38. No, Emmy, you are the best, okay? Because you are here showing up for yourself, trying to pass this freaking test. No, you don't. See my eyes a little bit. Okay? I'm tired. I'm also under the weather. I've got a little twinge in my throat as I complain to my wife about it. All right, 38. Let's go. Yep, B. Good job, guys. Administer IV potassium. So again, insulin drives potassium into the cells. All right, causing life-threatening hypokalemia. All right, so that must be corrected immediately. We had a question similar to this. Okay, yep, stop the problem. IV replacement is required. All right, here we go. Okay, 38, so we are looking for 39. All right, here we go, guys. Thank you guys for the follows. Thank you guys for sharing the lives. Much appreciated. Okay. 39. Holy moly, up over 21,000 likes on the live. Golly. All right, and now you guys are all over the place again. All right, 39. Answer is B, administer the albumin infusion. So this is what should the nurse do first? B, administer the albumin infusion. And I'll tell you why. Chill, relax, okay? So large volume paracentesis. It removes significant protein-rich fluid. All right, so that could risk circulatory collapse, okay? So the albumin restores that intravascular oncotic pressure. There's a $10,000 word for you, okay? And prevents shock. So here, measurements and weights are secondary. Okay? Boom. Administer the albumin. And in the question, it says the provider has ordered albumin. So administer the albumin. Okie dokie. I digress. Okay. They're like, oh, I see it now. Oh, yes. He ordered albumin. So I should administer the albumin. Okay. 40. Let's go. Home stretch, guys. Home stretch. All right. Oh, these questions are hard. Because the majority of you are wrong. The answer is B. Okay? Notify the surgical team. Okay? Here's why. It's okay. If you got it wrong, relax. It's all right. All right. The question is talking about and describing a ruptured abdominal aortic aneurysm. All right. This requires immediate surgical intervention. Okay? So calling the surgical team avoids any sort of fatal delay. Fluids may be ordered, and that's rational, but it's not the definitive life-saving action. Okay? Getting to the OR as quickly as freaking possible is. Okay? So oxygen does not address vascular rupture. Fluids must be given cautiously, okay, and under surgical direction. And positioning does not help. Okay? All right. Y'all are getting dark in the chat. Jeez. All right, 41. Here we go. Oh, believe me, I know. Reality is dark. I remember nursing in COVID. And that was some dark shit. All right, majority of you are saying D for 41. And by golly, that's incorrect. The answer is A. All right, the answer is A. Increased oxygen delivery. We're talking about COPD. All right, so confusion indicates severe hypoxia. All right, and correcting the oxygen levels is going to be the first priority. So without adequate oxygenation, no other therapy can be effective. Okay, antibiotics and bronchodilators follow stabilization. Okay. New onset confusion. It's new onset confusion. That is the red flag word you need to tag in that question. Okay. None of that other shit is gonna address confusion. Oh, we're gonna make nurses out of you guys someday, I promise. Okay. Keep learning. I'm here for it. I'm here for it. I'm here for you. All right. I love all the emojis in chat. All right. Thank you guys for the follows. We're talking about, yeah, for COPD, you don't give a ton of oxygen, but here they're confused. They're not having trouble breathing. Their respiratory drive is not compromised, but new onset confusion, and with the answers that were there in the question, you give them the oxygen. None of the other answers address the confusion. And so that's got to be the red flag. All right, 42. The nurse notices increase, another one where they notice increasing confusion. What is the priority intervention for 42? Okay, the answer is B. Okay, prepare for emergent intubation. So the patient has impending airway compromise, right, due to the inhalation injury, which they talked about, soot in the sputum, hoarse floors, so big airway clues. So fluids and labs can wait until the airway is secured. Okay, fluids and labs can wait until the airway is secured. So all of those things are indicating that there's some sort of airway issue. Okay. All right. What should the nurse do first? What should the nurse do first? All right. Seeing lots of A's, which actually is the correct answer. Good job, guys. It's A. All right. No trick there. No trick there. All right. So positioning the patient upright improves lung expansion. Okay. It's going to decrease the preload immediately, and it's the fastest intervention to reduce dyspnea. Good job. Give yourselves a pat on the back. 44. What action is the priority? What action is the priority? All right, good job so far. Oh my goodness. Yep, I've worked a 12-hour day today. I am tired. Okay. The majority of you have said A, and that's correct. All right. Yeah, putting that NG tube down is going to decrease or decompress the bowel. All right. It's going to prevent perforation and obstruction. Okay. It also reduces vomiting and aspiration risk. So pain treatment is supportive only. C can worsen the obstruction, and D treats a symptom, not the cause. Kayla, you are smart. All right. All right. 45. I'm like, fan club that pop up, get out of my way so I can see what question I'm on. All right. Here we go. All right, 5 questions left, guys. If you guys are just jumping in or been here hanging out for a while, go ahead and follow, because we do these lives Sunday, Tuesday, Thursday, 9 p.m. Eastern. Okay. On my page, if you go to my profile page, there's a little bell in the top right, which you can set up notifications to have TikTok remind you when I go live. So you can set that up if you want. Just make sure that your phone allows TikTok notifications in general in your regular settings. All right. 45 is a stop the diltiazem infusion. So it looks like the majority of you got that. So here, the patient's experiencing severe bradycardia due to medication. Stopping it prevents further decline. So good job. I don't think I saw anything other than A. 46. All right, here we go. Would you say, why not B, the atropine one? Atropine is appropriate, but not before stopping the infusion. Okay? Got to stop the infusion first. Address the problem. Okay? Okay. We got kidney stones, lots of pain, got a fever. What should the nurse do first? What should the nurse do first to help this patient? Okay? Here, we need to get somebody else involved. The answer is going to be C here, okay, guys? Notify the provider of the suspected infection. So kidney stone with a fever is going to suggest pyelonephritis, all right, which generally is going to be a urologic emergency requiring urgent drainage. So delaying increased risk of sepsis. Pain control is good and fluids are good, but that comes after the urgent provider notification. All right, so boom, boom, boom. Notify the provider. 47, 48, here we go. All right. All right. What should the nurse do first? Reports of new tailwind, difficulty walking, trouble, but this one's a little tricky. All right. The answer here, guys, is C. All right. Place the patient on fall precautions. So neuropathy increases the risk for immediate injury. Fall precautions are the top priority to prevent harm. All right, so a neurological assessment and provider notification makes sense, but they follow once safety is ensured. Okay? Antiemetics are unrelated. Okay? Safety first. with this question. There's no airway, breathing, and circulation issue. So we go down. Any Maslow? No. Okay. Safety. Yep. Okay. There we go. Okay. All right. Good, good. 48. Mm-hmm. All right. Awesome. Hawaii. Thanks for that. If anybody picked B, holy moly. All right, 48. Here we go. All right, answer is A, administer IV antihypertensives. Okay, so the patient here is showing signs of hypertensive encephalopathy. Okay, a life-threatening condition, requiring rapid blood pressure reduction to prevent stroke. All right, so if you got that, great. But comfort measures and positioning are going to be secondary. Vomiting treatment does not address the crisis. All right, good job, guys. So far, all right, 49. Here we go. Here we go, chat. If you guys have stuck around, good on you. Good on you for sticking around and putting in the work. Hope you've had fun engaging here and talking to your peers. All right, looks like everybody is smoking A here, and that is the correct answer. All right, so cover the protruding organs with sterile saline-soaked gauze. I feel like I remember having this question on my NCLEX. So yeah, you got to keep the bowel moist, which prevents any necrosis and infection. This is the most time-sensitive intervention, okay? So surgical notification occurs immediately after. All right, and then 50. And then immediately after this question, guys, just stick around for 45 seconds while we just wrap up, okay? And in the meantime, after you answer, if you have any feedback in the chat, please go ahead and drop that in there. Would love to hear your feedback on how I can make these lives a little better for you.
Excuse me?
What's up, guys?
All right. What should the nurse do first? All right. Yep. We are going to start IV fluids. Fantastic. All right. So this presents as right ventricular failure with obstructive shock. Okay. So fluids help increase prelude and cardiac output temporarily. Intubation may be required, but stabilizing the circulation prevents cardiac arrest. All right, epinephrine is not used in this condition. Okay. It's not B because intubation must wait until circulation is supported. Okay. C is just not appropriate for pulmonary hypertension, and D, Trendelenburg does not correct cardiac failure. All right, guys, boom, you did it. You did it. 50 questions. Let's go. Let's flex on them. All right? The NCLEX is going to be so scared of you. That's what I'm talking about. All right? So if you guys haven't already and you're still here, go ahead and follow. Okay? Again, we do these 3 times a week. Sunday, Tuesday, Thursday, 9 p.m. Eastern. Lots of content on the page. Tons. All right? A full 34-part NCLEX review series on the page. All right, go check it out then. If you're studying for the NCLEX, I strongly recommend a custom NCLEX study plan only because when I took the NCLEX the first time, I failed. But it was only because I didn't have the right structure. So that's kind of where this product came from. Okay. It gives structure to whatever resource you have, whether it's boot camp, Archer, simple nursing, whatever. I put that into the plan. So you're not having to buy any more stuff. Okay. It just uses what you already have access to. And it's $25. That's just for the amount of time it takes me to personalize it because I do these individually right now. So if you're a repeat test taker, it takes your CPR into account. All right, so I can tailor that. You give me your test date, and then we build the plan from today to your test date, okay? And break it into blocks, what you do each day, Monday to Sunday, okay? Yeah, it is... it's good from the feedback I've gotten, and there's been a few people in the chat tonight, who've gotten them. So check it out. It's in the link in my bio. And then also in the link in my bio is the NCLEX Vault, which just asks for your name and email, and it's free to access. It is 237 pages of just awesomeness, honestly. And there's cheat sheets on every single NCLEX subject there. And then after each subject is a 25-question mini quiz. All right, so check that out. All right. You have to request your CPR report if you're a repeat test taker. I think you request it from the Board of Nursing, I think. Okay. Absolutely, Julia. That's what I'm here for. Just here. To help you guys get across this line and make you guys nurses, because I guarantee everybody in this chat will be a nurse. I guarantee it. Just stick with it. It's hard. It might be the hardest thing you've ever done in your life to this point. It's hard, but it's hard for a reason, because it's meaningful work. All right. If it were easy, it would not be so challenging. All right. You need to probably expect a gut punch, all right, on a weekly basis. It's going to make you question if this is the right field for you. All right. It will. But it's hard because it's meaningful. All right. Things that you find meaningful are just challenging in life. All right. So you got to work for it. All right. I'm seeing a lot of mailing list subscriptions pop in for the NCLEX Vault. So, so MJ, where do we upload the CPR report? So when you select the option that says that, no, this is not my first time taking the test, it will ask you for the fields for what did you score above the passing grade in and what did you score below the passing standard in. So you just type those in. Okay. All right. Literally. Oh, I'm sorry, Dimples. Hey, listen, these things happen. All right. These things happen. It is just a detour. It is not your final destination. Okay. As long as you keep moving forward, you will get past it. You will pass your exit HESI. You will graduate. You will pass the NCLEX, and you will become a nurse. I guarantee it. Just stick with it. Stick with it. You've come this far. All right. It is delayed, but not denied. All right. That's right. All right. So we'll see y'all Thursday. Okay. So again, Sunday, Tuesday, Thursday. If you haven't already followed, give you another 10 seconds. So check that out. Check out the playlist. Check out the study plan. Check out the NCLEX Vault. It's all there for you guys. Okay. All right. That's it. All right. Have a great day, and we will see you Thursday.